number of infected COVID-19 patients continues to rise in Nigeria, the capacity of government health facilities may be overwhelmed in a matter of time. Now, against this backdrop, there has been a growing call for greater involvement of healthcare practitioners in the private sector in the battle against COVID-19. Health experts have also called for accreditation of facilities in private hospitals run by healthcare professionals in the communities as a way, of course, of expanding the country's capacity in achieving greater testing numbers. We're now going to look into this in detail by having a conversation with Clement Olaifa, the chairman of the Association of General Private Nursing Practitioners, Lagos chapter. Welcome to the program. Thank you for joining us.
Good morning.
Mr. Olaifa, good morning. Good to have you here.
Good morning.
Yeah.
Good morning.
Good morning. You're welcome. Now, as at May 1, the Presidential Task Force disclosed that the number of healthcare workers that have been infected in the course of their work with COVID-19 was about 111. Now, the Nigerian Medical Association disputed that, and we're told that the number has since increased to up to about 400 since then across the country. Now, how bad is the situation? And what are the kind of special risks that healthcare workers, nurses, doctors face? And what should be done about this?
Thank you for having me. The situation on ground, as it is affecting the nations of the world, we all believe that we must all hands must be on deck so that we can do the needful. I think government should be most sincere with all their whatever they are saying about the health workers, so that it can be better for all of us. The situation is that I think for all the health workers, people that are in the front lines of this combating this COVID-19, the government needs to do better, because the tools for people to work must be provided. I was listening to your program right now. We are talking about a remuneration for health workers, nurses, doctors. It is this time that people should be encouraged. And if we are not very careful to support these health workers to perform their duties, like you are saying, you have had the 111, the situation will be going up. I read that there is almost 230 something nurses that have died even by now in Nigeria.
Thank you, Mr. Olaifa. What is your take on the projections that Lagos State could soon run out of beds, as it's expected that the COVID-19 cases could surge quite dramatically? I refuse to say the number because I cannot believe the projections being made. I read a report about public hospitals in Mumbai being so overcrowded that COVID-19 patients are sharing a bed and that there's no more space in the morgue. So dead bodies have been wrapped in black plastic and kept in wards where they're actually patients. In order to avoid that kind of disaster, Lagos State government is advocating for people to treat themselves at home in the event that they do run out of beds. What is your advice on that?
Thank you. People treating themselves at home. I think some people have been treating them. Some people have been at home when they were tested positive, and government had already told them to stay at home. They have been doing it before they are announcing it. And I think if proper health education can be given to individuals about how not to infect others in their homes, it is not too bad. But what we are looking at the private sector, especially the nurses, is that there could be a good government support to all these private health facilities. I know there are a lot of people that have big facilities that they can create a very good apartment so that people that have COVID-19, because this thing is a virus that we have all said that is going to stay with us for some years to come. So government needs to build the capacity of the healthcare professionals private ones especially, so that they can be able to know how to arrange their health facility and create a proper place where they can start admitting or allowing such individuals to stay. Because if you say somebody should stay at home, now what if there is an emergency? Who attends to that person? Because there can be an emergency at any time. And sometimes you are calling the numbers to call for these emergency lines. You may not be through with them. You may not be having the information, a response that is required. So my take is that good. If those that are tested positive have not started manifesting severe symptoms, they can stay inside room. We have seen a lot of people have been doing that. I've seen a lot of people that have done that, and they have come out of the infection. But I think, putting everybody to be part of this, the private nursing practitioner, private medical practitioners, medical laboratories, putting everybody together, we can be able to manage this case better than we are doing now, I think.
Certainly and hopefully. And the Lagos State Ministry of Health have started an accreditation process for private hospitals, whereby they're looking to sign MOUs with certain private healthcare facilities that pass their accreditation process, obviously to help in terms of treating COVID-19 patients. Do you think that the Lagos state governments and other state governments across the country are doing enough in terms of bringing the private sector in and in terms of making this accreditation process easy for private healthcare facilities?
Thank you very much. I think Lagos State is doing something, but they can improve. My own advice is that there is a need to engage the private health practitioners. They need to engage us. What has been happening is that we have not been actively engaged. We've not been seeing any relationship that we think that is enough for us to be saying that we are working together. So when Lagos State, if they want to do that, it's a welcome idea, and I think they should actively do most of these things. Because what I'm always saying is that we must speak the truth, and all of us must know that it's when we say the truth, we speak what is, because sometimes we hear a lot of things on the news, and at the end of the show, they are not the reality on ground. So I think if they are doing it, it must be well done, carrying all the leaders of the association along. We have all the health professionals in all sectors that are ready to work with government. We are expecting them. We are waiting for them. If they want to engage us, they build that capacity so that we'll be able to do the needful. So it's my own candidate. My advice is that it shouldn't be of saying it. It should be of acting it. We are ready. We are waiting to collaborate with them, because this thing, by the time we know that there is a problem on hand, it is when we are easing the lockdown. By the time we ease the lockdown and everybody forget about this virus, that is when we are thinking there can be another surge. If that is the case, the private health practitioners must be well involved, because they are the first point of contact that most of the patients will go to. And if these things are not well done very well, you will see that at the end, the surge may be something we will not all be able to cope with. So if they have prepared, Lagos State has been doing fantastically well, but they need to do better. They need to engage the private practitioners actively, so that all what we are saying will be what is supposed to be, what will be seen. Will be seen, and everybody will embrace the truthfulness of all what we are saying.
Well, as an association of general private nursing practitioners, what are you doing to sensitize your members, or to retrain them, or to protect their interest? Because it's not just about government alone. What are you doing as major stakeholders?
Yeah, as stakeholders, we have sensitized our people to be very cautious, to look and be able to do proper triage, that is sorting out severe cases out of the minor ones, so that they will be able to identify the symptoms that are identifiable with COVID-19. And if they see such, they should be able to refer as quick as possible for now to the NCDC, where they can be properly managed for now. We have also done little we could do. We distributed, even we supported Ministry of Health with little thing we have. We gave sanitizer to them. We gave some of the PPE. Some other organizations have also been supporting us to provide PPE for us, personal protecting equipment. Some of them we are using and we are distributing to our colleagues. And even in the community, we are preparing to, we have already set up a committee to look into how we can have our own means of contacting everybody, relating with the government more, so that we can identify even within the communities those who are already positive. People can be positive, they will not show symptoms, but they have the power to infect others.
Mr. Olaifa,
Yes.
Can I ask you to please hold your thoughts? We're going to take a quick break and we'll be right back with more. Please stay with us. Welcome back to the morning show here on Arise News. We're still with Clement Olaifa, Chairman, Association of General Private Nursing Practitioners, Lagos Chapter. I wanted to ask you, sir, you've expressed your preferences, but can you take us through the particular consequences of a failure to fully integrate the public and private healthcare with regards to the COVID-19 pandemic?
Yes, the failure we have been seeing is that we need to appropriately be engaged, like I said other time. If we are not adequately engaged, like let me set a scenario. Sometimes I think in March, when this thing just started, when we have not even been more than 100, we are not having more than 100 cases, positive cases. We were trying to link with the NCDC. All the lines were not going, and there was an emergency in the hand of a health practitioner. So at the end, you will see that the patient, while waiting, decided to go back to his house. Before you know it, we need to engage the health practitioner, not on the basis of saying, call the public, the number that the public are calling. Because the public are also relying on us, that they believe we have a very cordial relationship with the government. So that's what I'm trying to say, that if we do not properly engage them as practitioners, not on the basis of the public, the way the public are doing, the general public are trying to contact them, we must be engaged. The advanced countries are doing this. They have what they call private health sector engagement, and it is making them to do the needful. So what I'm trying to say here is that it shouldn't be on telephone, that I will have to be able to relate with the people that are on the front line of, the NCDC that are in control of this project. We must be able to be part of those executioning of these activities. We want to be part of those who execute this, put it to the end of it. You cannot be on the public side alone, because all of us must be involved. So the failures are here and there, and people are calling you, please, I want this, and you are calling the numbers that are being given out. Sometimes there is a delay because of the lot of jam pad, because of the network, because of one thing or another. But if I, like a leader, have that capacity to say, oh, take this thing, carry your ambulance, carry this patient to this particular place, then that would be a better way that I think we can handle it.
Let me ask you something, Mr. Olaifa, with regards to problems that private healthcare facilities are facing at the moment. Last week, we discussed this in length. And one issue that I recall coming up when I spoke to the owner of a private healthcare facility is the fact that rapid test kits are not approved. So if we're looking at why a lot of private hospitals are having to reject patients, it's because a lot of people who end up coming to the hospital that may have symptoms similar to COVID-19 cannot get an immediate test, and therefore it's a big risk to bring them into the facility. Now, Why do you think we are having problems in terms of actually approving rapid test kits, especially in Lagos State, when we know that this is what private healthcare facilities really and truly need for them to actually deal with patients and take in patients?
Thank you. I think I would not want to say test kits that are used to confirm either positive or negative cases should be done in haste. I think procedures must be followed. So if those who are in charge of this authority says those kits are not appropriate, then I will not be here to say that they are appropriate. So I want to say that the basic truth is that some people that say that we are rejecting patients from the private sector, it is not true. We are not rejecting patients from the private sector, but the basic thing is that you need to be very, very cautious. You need to be able to quickly identify the symptoms that are related with COVID-19. So if you see one, you need to refer as quick as you can. It is not a matter of saying that we are rejecting. No. And the test kit, the proper validation must be done. I don't want to sit down here and say yes, because I want private health practitioners to be involved, then test kits that are not properly validated are used. I will not be here to do that. And I think the laboratory, there is another professional that is responsible for this. I think the laboratory scientists of Nigeria, their council are working hard to ensure that they do proper thing, to ensure that those kits that will be available in Nigeria, once they should undergo validation, and once they are okay, they must be used for the test of this COVID-19.
Anyway, before we bring this to a close, Mr. Olaifa, I would like to ask you about your association of private nursing practitioners. Is there any kind of connection between your own association and the National Association of Nigerian Nurses and Midwives? And your association of private nursing professionals, does it include those persons they refer to as auxiliary nurses? Are they also members of your association? Just for our education.
Thank you. Thank you very much, sir. We are all within National Association of Nigerian Nurses and Midwives. So we are part of NAM. We are part of NAM. Anybody who graduates from School of Nursing or University, you are a member of NAM. But the other question that auxiliaries know, the auxiliaries, there is nothing called auxiliary nurses as in our own book. A nurse is a nurse. We don't have auxiliary doctors. We don't have auxiliary lawyers. We don't have auxiliary engineers. We have engineers. We have nurses. Nurses are those who went to the schools of nursing, those who went to universities that study nursing, and with their studies, they graduated and they become registered with the Nursing and Midwifery Council of Nigeria. Those are the one called nurses. Any other way to change it is not acceptable. We don't agree with any other person saying there is auxiliary or there is, I don't know what that name they want to call them, but there is nothing called auxiliary in our book. A nurse is somebody who has gone to university or who has gone to School of Nursing to study nursing, and he has passed his exam and he has graduated, and such a person, such an individual has been registered by the Nursing and Midwifery Council of Nigeria. So they are not any other one outside them. They are not nurses and they can never be part of us.
Thank you for that clarification. And as we round up, what exactly would you like at this moment from the NCDC? In a minute, please.
Thank you. Thank you very much. I want a proper collaboration with NCDC. I want the NCDC to also engage the private sector. I think that the private medical practitioners, sometimes around, I think it should be around early May or within the April, they engage I read that they engage the NCDC. And they were trying to tell them that a doctor is a doctor. Either you are in the public sector or you are in the private sector. And all what we are all about to do is to ensure that we stop the spread of COVID-19. So the same thing is applicable to the nurses. Nurses are nurses. Once you have graduated from the school of nursing or you graduated from university, they are supposed to make use of all the professionals, not to have to create a dichotomy and be thinking that it is the public sector that will be properly engaged. And we must not be waiting for all the Western world to do the needful before we start following. Because I know today, if the Western world come out again and say that, yes, so we are doing this thing to engage the private, like Germany has been doing, Spain has been doing, UK has been doing, all other advanced countries have been doing. I know Nigeria is supposed to do the same thing. We are not supposed to even wait for all these people before we know that this thing we are talking about is a virus. This virus may not go on time. Then there is a need for us to say, those who are very close to the community, who are those close to the client, close to the citizens, they must be properly again, the NCDC must call us. They must actively engage us, not to be hearing what the NCDC is doing on television, hearing what the NCDC is doing on media. No,
Thank you so much. Thank you for joining us this morning.
Thank you very much
indeed. Thank you for joining us this morning.